Every praise, every praise, every praise, every praise to our God. Sing hallelujah to our God. Glory, hallelujah, glory, hallelujah to our God. Every praise, every praise, every praise, every praise is to our God. Every praise, every praise is to our God. Every word of worship, every word of hope, every praise is to our God. Oh, sing hallelujah.
Good morning. I came to this conference last year and I was so impressed with all of the offers, everything that was offered, the guest speaker. I knew that probably surgery was going to be in my future, so I talked to the J&J people, I looked at all of that. But let me just start off telling you that one of the sayings I say for my life is, I'd rather wear out than rust out.
That's it.
And let me tell you how I have successfully worn out. So in my youth, I had no athletic ability. So I became an athlete at an older age. I became a walker. Then I was a race walker, competitive race walking. And at the age of 62, I became a runner. I would not advise that. It's probably not the best age to start running. So I've done 5 half marathons. I ran a full marathon. That is 26.2 miles. I taught aerobics for 7 years. I taught Zumba for 10 years. And currently I am a water fitness instructor at the OrthoND Foundation YMCA. I've been teaching water fitness for 3 years. I play pickleball, I do strength training, I had a class at 6 a.m. today. So I'm still very active. Movement is everything. Our bodies are designed to move. Well, in March of this year, I went to see an ortho surgeon because I was having pain that wouldn't go away. People were talking about the shots that you can get to kind of hold that off. And so because I'm so deathly afraid of shots, medicine, and everything medical, I put that off. So when I went to the surgeon, he said, well, you can get the shot, but it's not gonna help you because it's too far. So I had osteoarthritis. So on May the 28th of this year, I had my left hip replaced. It was outpatient surgery. Surgery was at 7:30, I was home by 3. I did everything my doctor told me to do. I did everything the physical therapist told me to do, and that makes a big difference. I was on a walker for 1 week. I was on a cane week 2, and I haven't had anything else since then. Thank you. I have a video of me dancing at a party 5.5 weeks after surgery. And my doctor was so impressed, he asked me to send him that video so he could share it with other people. And so there's been pain. In fact, the first day after my surgery, when that pain block wore off and I didn't get my pain meds in time, I wanted to chew my leg off. It took me 30 minutes to get off of my sofa that day. But after that, it got better. But again, the key is movement. Being active before, being active after, doing everything your doctor tells you to do. So I just want to give glory to God, for He is the healer. Yes. To my surgeon, Dr. Mark Hood, who is wonderful. And then to my daughter. My daughter is a nurse manager at Emory Hospital in Atlanta, and she came home for 11 days to take care of me. I think she was ready to go home. I was ready for her to go home. But I do know that my healing would not have gone as well if it had not been for her forcing those meds on me. So I just encourage anybody, back in the day, if you had arthritis, our parents, grandparents, you just lived with it. You suffered with it, you endured the pain. You don't have to do that anymore. You can get things patched, replaced, repaired, and go on with your life and have a quality of life. But the key is movement. Keep moving. If you don't move it, you will lose it. Yeah. Thank you.
So first of all, thank you guys. Definitely appreciate we actually look at this as an opportunity. And with all opportunities, it's not one single person that does this. These things happen with other teams. And one of the things I wanted to do is acknowledge some of the J&J volunteers in the back. So if you guys could stand up for me, I want to just acknowledge that we're really working I'm also excited that we've got Dr. Dayse Repsold with us today. When we go through these, it's all about information, education. And even I think, I don't know where you're at now, but I love the story, right, of the journey of kind of what it takes. These things are journeys, right? It starts with a little pain, there's a lot of process, there's a lot of knowledge and insights in terms of how we can try to get through this. What we want to do today is just basically share what the journey looks like, how we can help you with some of those things. Dr. Repsold, I know that we have slides, because I was going to try to touch base on a couple of those. But one of the things that we found over time is working with Janice. And Janice brings a lot of this to our attention. But unfortunately, there's a lot of disparities in terms of as African Americans and things of that nature. Thank you. How we take advantage of some of this information and insight. So again, I want to bring that up because today we want to share that information. We want to help everyone to be able to take advantage of these type of services that we get. If you could maybe come to the next slide for me, please. There's a lot of misinformation that's out there. I think Anita shared some really good insight today, right, of her journey. She's on point, right? Keeping moving, all of those kinds of things, I think it makes a lot of sense. And following up. And in the journey, we also have not only yourself that's going through that, but if you think about your family and people around you, they're all involved with that process and they're impacted as well. So one of the things I would share is that we want to share this information with everyone, families and those who are going through this as well. And again, from a mistrust, lack of knowledge, we want to address those things today. Some of the folks who are in the back of the room today are going to help. We've got a lot of information we can share. I know Janet put a lot of the information in the packets and things on the table as well. So please take a look at that. One of the other things I did bring up here with, I think Anita mentioned Dr. Whitehead, but one of the things we've provided with us today is as an action that you can take. Who can you talk to? Who are some of the surgeons or people in your area that you can begin to start building better insights and information around? So we have those kind of brochures that have references to some of the local surgeons, the community north, or maybe surgeons, those kinds of folks. So please come back and we'll share that information with you. So, I'll skip this and I'll just kind of go to, I want to just introduce Dr. Repsold. She was here last year. For any of you guys that had a chance to hear her, she was just very, very dynamic, very engaging. She is full of energy, and it has so much insight and information. We're always happy when we get some of our medical team that can come here and share, insightful information. So we're happy that she's here with us. I'm going to kind of turn it over and allow her to kind of go through that. So thank you guys, and we appreciate the opportunity.
Good morning, everyone.
Good morning.
So, first of all, it's a huge, tremendous honor to be here. And the reason is because my first commitment is a way before Johnson & Johnson and the few centers. My first commitment, when I decided that I want to go to med school, was with all of you. This is what it matters. My main objective is and was and has to keep being take care of patients. So one of the things that was here, why do disparities exist? If you look at the last bullet, it's saying cultural difference between doctors and patients. We don't have to have that. And between a relationship between doctors and patients always has to come first. Right?
Right.
So if you, in your life journey, when you have a meeting with a surgeon, with a clinician, with a health practitioner of any kind, if you don't feel like you are the star of those relationships, move on. Change the provider, because this is not good enough for you. So you have to be respected and embraced in any kind of healthcare relationship that you need. You are the main and the most important star in this relationship. Okay? There are some things that you have to go through. I will do, as any other technician, any other medical, any other surgeon, I will do the best that my knowledge allows me to. And these are the tools that I have to serve you guys better. But you also have to help yourselves. The way that you help yourselves is being aware of anything that happens in your body. Your body talks, and you have to be prepared to listen to it. The body gives all the hints. The body gives all the clues. Hear that. Listen to that. Because you are the main helper of your life journey. And when you understand what is going on, what is the problem, what are the issues, and how you can help, what are the resources that you can look for to help yourself, you will be a way more proactive, a way more helpful to yourself, and then you will be managing any kind of situation in a better and in a direction of a better outcome. So you have to work together, but you have an important part to do in this relationship. Okay, now this thing. So my name is Dayse Repsold. I put the in parentheses because nobody knows how to say my name. As you notice, I'm not American. I'm from Brazil. And so you also notice that I will have a lot of English mistakes. I'm sorry. I wish I could make it better, but I will hope that at the end of the day you will get my main message. So, but if you don't, interrupt me and say, not good. You don't say this word right, so I will be learned. I am the Senior Medical Director for the Keynote, the company of Johnson & Johnson, and I am with them for about 17 years. And I am orthopedic and trauma surgeon. But you see this letter after my name doesn't mean anything. Still, whatever how many letters I have after my name, you are still the most important person. Those letters just graduate me to serve you better. So don't be ashamed or impacted by the letters after my name. Not mine and nobody else. Okay? Let's talk about the disease that is probably, I would say 90% of all orthopedics disease has something in common, is osteoarthritis. So except for cancers and trauma, the disease for orthopedics probably have in common osteoarthritis. You're going to be talking about that. And you're going to be focused on two articulations, two joints, hip and knees, okay? This is the hip joint. So we call hip joint ball and socket joint. And the reason is because, you might to hold this microphone, please? The reason is the hip has a cup, and the femur, at the end of the femur, has the head of the femur that go connect with the hip. So it's a ball and a socket. So this is why we call it ball and socket joint. And it's very stable articulation. So are you still? So this is the femur. This is the end of the femur and has this spheric form, so you call this the ball. And this is the hip. And inside the hip, that is this cup that I mentioned to you guys, where the femur head will connect with. So this is pretty much the hip joint. And this is the knee joint. Okay, on the knee joint anatomy, you have the composition of three bones: the femur, the patella, and the tibia. This is the knee joint. Holding this bone structures, you have four main ligaments. The cruciate ligaments, anterior and posterior, and the collateral ligaments, lateral and medial. So this is a stable joint, a normal joint. This is the anatomy of the knee joint. Osteoarthritis. You know, in medicine, a lot of terminology comes from Latin. So to understand what it is, you have to get some clues on Latin. So, osteo means bone, arthro means joint, and itis means inflammation. Inflammation on the bone, but any other inflammation in the body. When you see the suffix itis means inflammation, wherever it is. Here is a bone and joint. So osteoarthritis means bone and joints inflammation. So here you can see a healthy knee, and this is the femur, this is the tibia, this is the patella, and this is the articulation. And we have a space between these two bones. And here we have a graphic of a diseased knee joint. And we have all this erosion going on the cartilage, and also the bone get affected. And here on the hip, so on the right you have the knee, the normal hip joint. On the left you have the hip joint affected by osteoarthritis. So you see the destruction. So it comes from here to here. And this is what the inflammation on the joints can become and can make your joint suffer. So what is osteoarthritis? Osteoarthritis is a progressive, irreversible loss of articular cartilage that leads to pain, stiffness, loss of mobility, and sometimes deformity. Some of us here, me included, we have white hair. And when the white hair bother us, we dye it, right?
Right.
I have been doing this for a long time. So, it's a part of life. It's a part of journey, right? You get white hair. Okay, we can deal with that. But that doesn't mean that you have to suffer with that. So in the first day that the white hair bothers me, I am able to do something, right? Same thing with joints. It's part of the life? Yes. Wear out. We think, wear and tear. You have to be suffering for that? Of course not. So in the same way that you can dye your hair, you can treat your osteoarthritis. You don't have to be bothered by that, right? It's a little bit more complicated, a little bit more expensive, but you can do it. So the most common form of arthritis is the osteoarthritis. There is some other forms. The most common, osteoarthritis. And is associated with age, like the white hair. Is also associated with overweight. And this is why we say that it's a wear and tear disease. It is also can be associated with trauma. So when you have a trauma that change the balance or the well-being of your articulation, this can be precipitating somehow the osteoarthritis. So in this case, you don't have to wait for 60, 70 years to notice an osteoarthritis. You can have it very early in the life journey. What do you go with osteoarthritic joint? So all this are the symptoms: painful, stiff, swollen, deformed, noisy, unsteady. All those are symptoms. But if you think that the first one is pain, we have to think about that. Because pain is a symptom. Pain is just your body talking to you that something is not right. And even when we're willing to have this pain away, pain again is a good caller that something is not right. So the big mistake is I get rid of the pain and then I don't treat the disease anymore. This is a big mistake because when you get rid of the pain, you're not necessarily addressing the disease that is going on. The disease is still there. You're just treating the symptom. So imagine an iceberg. When you look at the top of the iceberg, this is just the tip. There is a huge structure beneath the level that you can see. Same thing here. So treat the pain, of course. Nobody has to live in pain. But don't forget that the pain is just a communication between your body and you. Pay attention. Something is going on. And then, if you treat the pain and don't address the disease, all the other bullets will show up somehow. And I spoke with someone today. When you go to your doctor, and I promise you, the most important tool that I have, being a surgeon, my hands. Let me touch you. Let me examine your body. Because probably most of the information that I will receive from your body, I will receive through my hands. So I have to do, so when you go to a doctor that don't touch you, that don't do a good physical exam, remind them, say, well, I was in a meeting and the surgeon said that all the doctors should examine and put their hands on me. Please feel free to, because it's a very important step. And if I replace the power that a good physical exam give me, and I replace that by images only, something is not right. The imaging, and you have to have good x-rays, but we call this complementary exams because the physical exam has to give me most of the clues that I need to have a diagnosis mindset. So what will build the mindset, what will give me all the clues that I need, when I order one x-ray, I have to be already aware of what I'm looking for. If I don't know and I just ordered an x-ray, when I find it, I won't recognize. Okay? So, be mindful that you deserve to be well examined. So, when I do this good physical exam, I will do first a good visual inspect. I will see if there is some imbalance, if there is some scars, if there is some, so you know, all the hints that I can have. There is a limp, there is a crack, there is any effusion in the joint that I am examining. How is the ROM? ROM stands for range of motion. So how much the patient that I am examining can extend the knee, can flex the knee, extend the knee. I have to hold myself. I will help you, help me again. I will share you will share the things. So flex the knee, extend the knee, flex, extension, flexion, extension. So how much is your range of motion? And for the hip, the same thing. How much you can open your hip, close your hip, rotate your hip. So all this I have to ask you to do when I am doing an appraisal, when I'm doing the physical exam, because this will give me some hints, okay? So this is what we call ROM, range of motion. Do you have any instability? When you walk, you limp, you feel like instead. So I have to be aware of your BMI, body mass index. Are you overweight? Because when you get older, and I know this is so sad, when you get older, we win some pounds, right? And I was talking with someone today. When I was young, I always complained that I was super thin. And I said, I want to be big. I want to have tights. I regret so much. Because, it's so much harder to lose pounds when you get older, right? Yeah. Tell me that I'm not alone in this story. Is that right? Okay, thank you very much. But so, I have to be aware if there is any overweight, because think, my knees, my hips are holding and sustaining my body weight. Right. If it's 60 kilos, okay, this is how the weight that they have to handle. But if it's 120 kilos, I am imposing double weight in the same joints. So that you will pay this price. So it's important to figure out the body mass index. You know when you were in the doctor and they ask you, in a scale of 1 to 10, how much is your pain? This is why. We have to know 1 to 3 is low, 4 to 7 is medium, 8 to 10 is high. So it's important to figure out how much is your pain, how much suffering you get in from this pain. And here are the x-rays. They are valuable, absolutely valuable. They will give me things that my bare eyes won't be able to figure out. But again, it's a complimentary exam, okay? So when you look at those are the knees. So when you look at there is a space between, this is the femur, this is the tibia, and you see there is a space between these two bones. So when this space gets smaller, it's because something is going on this joint. So one of the aspects that is measurable and seeable in the x-rays are this distance between the bones that we are examining. This also applies to hip. So if you look at this one and you see the space, and when you look at this one and you see that the space is a way smaller and there is a wider image here, this is one of the signs of osteoarthritis. And this diminished in space is painful. by itself. And when you look at the hip on the right, you see that this is the, I won't say normal, but this is a better shape hip, because you still see there is a space, but the space is already smaller than should be, and there is also this white line here that normally you shouldn't have. This is another sign of osteoarthritis. So this is the beginning of the disease, but this is how the disease can end. So here you don't see space, you barely can differentiate the two bones, the hip, the hip bone and the femoral bone. So it's all a big mass of bone. So this is how you will see a severe case of osteoarthritis. So between this and this, I promise there is a lot of things that we can do to avoid getting this condition. To control the pain, you can have a bunch of anti-inflammatory drugs and will alleviate the pain. You can get glucosamine sulfate, you can have hyaluronic acid injection, you can have local balms, creams, hot and cold packs, sleeve embrace, cane walkers, physical therapy, acupuncture. There is a bunch of non-surgical measurements that you can take to alleviate the condition that you're going through. And these are the non-surgical treatment options. So pain controlling again, activity modification, weight reduction, physical therapy. Let's talk a little bit about each one of this. Pain controlling, we already talked. We don't have to live under pain. But resolving the pain doesn't mean that you are resolving the disease. You're just treating the symptom. Active modification. It's so easy to get lazy. It's so easy to say, you know what, I'm not walking today. It's cold outside, I have something to do inside. So you always have a huge list of excuses to don't be active, right? Big mistake. Because every time that you stop moving your body, understand that this is the thing that they have to do. So let's be immobilized. And when your joints and your muscles understand that, they get even more lazy. So, and this is the first step to be overweight. So one thing gets to the other. And then, if you don't change, if you don't become a little bit more active, and not saying that, who was the person that run you, my hero for today? You don't have to run a marathon like she did, but you have to wake up with the mood to keep moving throughout the day. You can start with small steps. You can go from one room to another and do this back and forth. But you have to instruct your body that they have to be active. You know what? We'll have the eternity to be inactive. So let's enjoy while you can, right? And then there are some surgical treatment options. And again, there is a huge, a good amount of things that you can do, even in surgical terms. You then have to start with hip replacement, knee replacement. There are some other steps that you can go through addressing the disease, but that will somehow postpone the need of a joint replacement. So this is why it's so important to hear your body message. Because osteoarthritis didn't start with the severe and damaged situation. It started initially with a little thing, another little thing, and another little thing. You start pain, a little bit pain, and you didn't pay attention. Or you just took the medication and said, now I'm feeling okay, now I'm good. And you keep not doing the things that will address the disease. So, to every single sign of something not right in your body, pay attention to it. There's a huge message behind it. So the steps that you have. So you can, sometimes when you have osteoarthritis, one of the initial signs is all the joints, not all, but most of the joints, at least hip and knees, they are infused with liquid. In the situation of itis, one inflammatory disease, this liquid, to protect the body, becomes bigger in amount. And this will somehow distend the joint. But the joint is a closed space. So there is an amount of distension that is possible. After all, the distension gets reached to the maximum level, will start to pain. Okay? So then you can, if you see that you have a lot of swallowing in your joint, that probably because there is a high level of liquid inside. So this is why aspiration is one the same way. So hospitalized more than 2 weeks. 18% of white population be concerned about that, and 45% of African American population is concerned about that. Understand joint replacement. So the information is much more accessible to the white population. Why? How come? Why the level of, why the tone of my skin change that? How come? It's not related to the color of my skin. This is an information for human beings. So, thank God that I'm not an African American, because I will be a revolutionary person. I will be in jail in 5 minutes, because I get so frustrated with that. So, African American population hear more about joint replacement than white population. So again, it's a matter of access. You have to have the same access that I do. Simple like that. We're both human beings. Doesn't matter the color of the skin. What we have inside, the same joint that I have, you have. The same blood that I have, you have. Why would it be different? Because the color of my hair or my eyes? Really? Remember that I mentioned to you that to do osteotomy, we have to have only one side of the joint of the knee being affected. And this is what we call unicompartmental knee disease. So again, if I trace a line that divides the knee in two halves, I will have two compartmentals. One is the medial one is the lateral one. So most effective one is the medial one in everybody. So the medial size of your knee is normally most affected than the lateral one. The space between the two bones can collapse, and this changes the alignment of your leg. So this is a good example. So this is the normal alignment. And when you have the disease eating the medial part of your, the medial compartment, you have this kind of leg disease, bone legness. And this overweight on the medial size is a good contributor for pain. And this is a good image, X-ray image of a unicompartmental disease. So when you look at that and you see the streamlined space here compared to the other side, so the medial compartment is so much has so much less space than the lateral one. So this is an indicative of this compartment is being affected by osteoarthritis. And this is further steps down the road when you have a more severe destruction. And this is how, if you compare the lateral compartment with the medial one, this is how is a schematic picture, but this is how your cartilage will be seen compared with the normal one. And I think that we have, and when you're going to check the booth outside, back there, I can share with you because we have some displays that show the progression of osteoarthritis. When you have unicompartmental disease, only one side of your knee being affected, there is some options. The Keynote has some options for unicompartmental joint replacement. So you don't have to replace everything, because this side is pretty normal. The only affected one is this one, so you can treat only this one. This is what we call unicompartmental knee replacement. And this is when you have the entire joint, the whole joint being affected. So the lateral and the medial compartment. So you see there is a big destruction here. When you look at the lateral view in the X-ray, you see the amount of bone production. You barely can see the space between femur and tibia. And this is the patella. And so it's a massive destruction, and this is the multi-compartmental disease. And for that situation, you have the total knee replacement. So this is one of the options that the Keynote has. So this is the total knee compartment disease. So you change the entire articulation in femur, the entire articulation in tibia, and then you have what we call total knee replacement. So, and this is the same concept for knee and for hip. So everything that I said about knee is applicable to hip as well. So what is the hip replacement? It's the same thing. It's a surgical procedure that removes the diseased articulation, the diseased joint surface, and replace it with implants. So here is a picture of a very severe hip disease. So when you get to this stage, there is nothing else to do. So even if I do a cut here and change the undulation, the destruction in the surface is so major that there is nothing else to do. So you have to replace. So you go from this to this. And one of the things, the technicalities that you have to achieve, one of the main failures of joint replacement is when you look at here, you see there is a metal here, and this metal is interacting with the bone. This is in the femur. So this interaction has to be and be maintained very steady, very fixed. So everything that moves, change the movement point from this relationship to here is beneficial. And then now what we do in the Keynote is the type of prosthesis that we have allows, because this relationship between the prosthesis and the bone in the femur happens also in the hip. So there is a metal here going inside the bone, and this relationship between metal and the, don't get scared, you won't see that. You only get the benefits. I will see them, I promise. So all this relationship between the metal and the bone has to be very, very steady, very, very stable. So where the movement will happen? So the movement will happen in what we call bearing. So that is between the head, the new head of the femur, and the hip, that is what we call liner. And this is where the movement happens. So the part that is attached to the bone, not supposed to be moving, and won't be moving, because the movement, when you move your hip, the movement will be between this part and the liner here. This is what we call bearing. So this is what I just explained. What is bearing is where the movement happens between the head, or now the ball, and the hip. So it happens between the ball and the line. I think that you have some examples in the booth back there. So those are some of examples that you have. And then you have some technicalities. So there is different types of material that you can make and construct the joint replacement. So it can be done with metal, different types of metal, can be done with plastic, different types of plastic. Normally we call the most common plastic that you use is polyethylene. And then there is different types of other materials, and now one of the most popular one is ceramic. Ceramic is a very, what is the word for that? Resistant, and it's very light. So this is why it's one of the options after years and years of study throughout the industry. The engineers come up with ceramic as a good option for joint replacement. So you can have, you can mix this different materials together. So you can have a prosthesis that is ceramic on ceramic. So the ball is ceramic, the cup, the liner is ceramic. You can have the liner in polyethylene and the head in metal. Or you can have ceramic on polyethylene. So there is a difference, and each one of these distinctions will be case by case evaluated, depending on your needs, depending on your size, depending on what is your condition. One or other will be more applicable, more well applicable. So the good advantage of DePuy synthesis with what we have is a huge amount of options to fulfill different needs. In a recent study, this is from last year, so 600 people who choose hip replacement, more than 96% said that hip replacement enabled them to move freely or without pain. 90% say that they are able to participate in favorite activities. Another study said that more than 95% of patients who receive Corio and Pinnacle, two systems of the DePuy synthesis, did not have any concerns even after 10 years of the surgery. This is a mutable, not changeable truth? No. We may have some cases here and there that doesn't have the same records. It happens. It's not mathematics. Is live organ, so can be different for a variety of reasons. So, but 90%, 96% have a very good outcomes. So, here's a quick quiz. How many people in the United States undergo knee replacement surgery each year? So what do you think? 150,000, 790,000, or 400,000? What is your guess?
400.
400,000? Yeah? 790,000 patients has. Because this is the second question. You see the second question? What is the disease leading cause of disability in U.S.? Heart disease, diabetes, or arthritis? Arthritis. This is why. So you are a leading cause of disability, even more than diabetes and heart disease. So there is a lot of people. Because, and the reason is simple. Again, we have at least two joints holding our weight throughout the life. It's a lot of things to hold because it's every single day. It's worse than marriage, right? Even worse. And how many people get married for 10 years? They give up on way before, right? So, many times I look at my husband after 32 years of marriage and, you know what, you look like also trying here. So it's impressive, these numbers, right? So it's a lot of numbers. And there are some myths that you have to, let's go through all these 5 myths that we have. So, number 1, arthritis pain is just part of aging. It's just something that you learn to live with. Right? Remember the white hair? Same thing. It's part of the aging. Yes, it is. You have to deal with that? No. No. So, 2, total joint replacement won't feel natural. If for the 96% of people that has a good outcome, that has a good result, they don't even think that they have some prosthesis on their body. You know, unless you have some problems, you won't feel that you have something in your body. I am too young for joint replacement surgery. This was false. This was true some years ago when the joint replacement was designed and manufactured for elderly. Not anymore. And you know why? Because people are getting more active. So even a young person, even a young population that started doing more sports with more impact. You know, if you look at the knee of a soccer player or a tennis player, if you imagine that all the movements that a tennis player does is like that, and they put a lot of stress on the knee, so the wear and tear of this knee, even being an athlete, is a way more than ours. So, and because of that, because there is a younger population with more stress on the joints, we have to think about, okay, how are you gonna address that? Is a new need. So companies like the Keynote has to be thinking about, okay, now you have a younger population that is with the same need than the elderly, because they are overusing the joints. Right? So there is no I'm too young for joint replacement. I should wait as long as possible to get a total joint replacement. The problem with that is, this is also true related to the previous one. When we have joint replacement designed and manufactured to elderly population. Not anymore, not today. And the problem with that, if you wait too much, you saw that the destruction will be more severe. So we'll need more resources to recover. So this is another myth. All joint replacements are the same. Again, no. It's not the same within my industry. So in the Q-Synthesis, when I look at the portfolio, I have more than one option. So if it's not the same in my industry, it won't be the same in the competitors. It won't be the same in the industry at all. So, I have something in mind when I design this family of prostheses, this family of prostheses, and this family of prostheses. We just tackling what is the condition that is more specific to. So there is no one fits all. And here we're going to be talking about each one of them again. Reality is that conservative treatments can lessen pain but may prolong limited function. And this is the issue that we mentioned already, that you discussed. Be careful when you get rid of the pain if you're just taking medication, because the medication won't change the status of your joint. Okay? So be careful. And don't think that just because you're not feeling pain anymore, everything is solved, everything is addressed. It's not. The second myth is total joint replacement won't feel natural. We talked about that already. So there's been many advancements in implant material for joint replacement. Diffuse synthesis joint reconstructions offer more implants options than ever before, include a wide range of size, design, and materials. Is what I told you before. There is different types of material, different types of model, size, and options, depending on what is the specificity that you need. I'm too young for joint replacement surgery. Again, not true. Total joint replacement are not based on age anymore, but on the personal level of pain and immobility. Myth 4, I should wait as long as possible to get a total joint replacement. Another mistake, another myth. We should get a replacement as much as you need it. So let's get a good impression of your knee, a good physical exam, good x-rays, and see what it stands for you. What is the most available and most well-fit options that you have. All joint replacement are the same. Again, no. One size don't fits all. Joint replacements vary by shapes and design to accommodate specific patient needs and lifestyles. And here the benefit of walk. Walking is a wonderful, wonderful resource. I'm not talking about running, I'm talking about walking. And when you walk, you send message to your homeostasis, to your body, that we have to keep active. Again, remember, you will have the eternity to be lazy. So use what you have in your advantage. While you are alive, be alive. So, let's be active. We should start moving today and running and walking. No, this is not what I'm saying to you. What I'm saying, that is obvious advantage of being active. But this advantage has to be fit in your body conditions. So before moving out, talk with your primary care physician, talk with your orthopedic surgeon, see what is the status of your baseline to see how much you can start doing. You maybe start with just 10 steps a day. Next week, you're going to go to 20 steps a day. It has to accommodate your need, your body conditions, okay? There is some general advantage. You strengthen the muscles, you lubricate, you have more lubrication on your joints, you improve flexibility and range of motion, you decrease the odds of new knee pain, and you reduce the risk of osteoporosis by building bone mass. So there's a lot of benefits in being active. Look for them. This is the benefits for the joint health, but is there also benefits for the overall health? Your weight management, your improved mood. Don't talk to me when I come back from the running. So, respect the mood fluctuation. But after 10 minutes, okay, you can talk. Okay? So, but that is definitely an improvement in the mood. When you feel more active, when you feel more prone to the life, you have a better mood, no doubt about it. It has cognitive function. This is very much true. Boosts circulation, and you have a better sleep. Of course, you're going to be so tired that you're going to lay down and sleep. No other option. But anything that you do, don't start before you talk with your primary care physician. Okay? But if they give you green light, go for it. Start moving yourself. Start to dance, start to walk, start to do something that make you bring a smile to your face. I think that's it, people. So thank you so very much.
Presentation. My question is, what is the typical longevity of a hip replacement and a knee replacement?
Great question. Normally, I will talk for the Q-Synthes, okay? Normally, and studies have been shown that after 10 years of hip replacement and knee replacement, you don't have to be concerned about any changes in any other operation. Again, when you buy that beautiful couch that you spend a lot of money and your husband gets crazy, you go, why you bought it? And you see the kids putting the shoes on the couch.
Hello, everyone. My name is Gloria. My question is, before you have the surgery, is it very important that you take a coaching class?
It's very important that you have a good relationship with your primary care physician. They have to explain you everything that you will be facing ahead of that first day, that first meeting. So what is your condition? Where, in what stance are you? What is the best options for you? Maybe it's too early to do a more aggressive treatment. Maybe you can start doing some, hormone acquisition, for example.
So when I tell you not to eat at this particular time, and everything else in your body is telling you, I ain't paying that little brother no attention, I'm about to get me some of this. You have to go back in church, go back in your Bible, and you have to reel that scripture out of the Bible. I can do all things.
New strength.
What is it? I can do what is it?
All things.
Has anybody never heard of that? You ain't never heard of that? So we talking, except when I need that sandwich, right? I need this sandwich right now. So Christ, I'm gonna have to send you. I'm gonna take the Bible in the other room so I can get this sandwich. Because I don't want nothing to keep me from dealing with this stress. Because Juju just got locked up, and I need something right now, so I'm gonna eat this sandwich. And I'm saying to you, fam, the reality is, the times are so dark right now. You need your health just to be able to think clearly through the challenges that we're in right now. Did you hear me? So in our program, we teach people how to eat in a manner where the body will be healthy again. And we have some success stories actually in this room. But if you look on this screen, y'all see where it says weight loss, 100% success rate? Let me look around the room. I know some people out here, no, they ain't got no 100% now. Now, y'all might be all right with 100%. I'm gonna prove it to you real quick. Anybody ever cut their hand? If you cut your hand, does it heal? Is that a yes? Yes. Who heals your hand? The doctor? Whoa, this table right here is on point, boy. This is the prayer warrior table right here. I'm gonna stand behind y'all. Y'all all right with that? God heals your hand, right? So if you cut your hand 100 times, how many times will your hand heal? 100 times. How many? 100 times. Because God has already equipped the body with everything that it needs to heal itself. Right? So we teach people what's going on inside of your digestive system, so that if you approach your digestive system properly, then everything internal can heal just like your hand heals external. Your body heals itself. Medication does not heal. Okay, some of y'all don't believe me. This brother's in here blaspheming. My doctor said I need this high blood pressure medication. Right? I'm going to prove to you in 30 seconds that it's not healing. If it did work and it did heal you, then why you got to take it forever? What's the extra? I want y'all to, everybody that takes high blood pressure medication, don't raise your hand. Don't raise your hand. Don't raise your hand. Because I already know. This is what I do. But I want you to look at the bottle, and I want you to look at the expiration date. When can you stop taking it? Oh, y'all already look. So, how is it working? Back in the day, when I got sick, my mama took me to the doctor. They gave me some medication. It had an expiration date on it. I took it for 2 weeks, and then we didn't take no more. Right? Why is it that you got to take medication forever now? If you got to take it forever, then something ain't happening. Just think about that, common sense. But when you stress, cause Ray's and locked up, somebody just died in your family, your feet hurt, your back hurt, you can't see, right? You can't, the bills, and so you're so stressed, you can't even think clearly and ask yourself that simple basic question. So the reality is, high blood pressure is when you have items or oil or something inside of your arteries. If you guys were ever a child and you played with a water hose, if you squeeze the water hose, the water comes out faster, right? So the less space inside that water hose, the more pressure in it. So when you eat bad food, that remnants of that bad food gets inside of your arteries. Matter of fact, let me come from this angle. Has anybody ever fixed fried chicken before? Please raise your hand. If you fixed fried chicken before, please raise your hand. Okay, so do anybody remember that little oil can that used to sit at the back of the stove where you put your oil in? Y'all remember that? Oh, everybody had that oil can, didn't it? Right? So this is my question. How many of y'all poured that oil can down the sink? I heard of never. That means she tried trial one time and got a whooping. Y'all hear how powerful she said that? Has anybody ever poured that oil can down the sink? Why? Lord have mercy. Lord have mercy. All of y'all say the same thing, right? You said you're not going to pour that down the sink because you'll clog it up. Do you know that the pipe on that sink is about that big? Has anybody ever got a drain clogged before? Think about the difficulty that it is to get it unclogged. You have to use a plunger and push and pull and sweat or get a chemical that's going to eat it out, right? So the difficulty factor to get a sink unclogged is this big. How difficult is it to get your artery unclogged that's that big? So we won't pour the grease down the sink, but I swear to God, we pouring it down, you know what I mean? We Popeyes, come on now, churches, come on now, I'm in the line too, y'all. I know y'all, I can tell anybody's gonna be lying in here now. I will call you out if you start lying. I promise I will. All that grease. Just think of how many French fries you done ate in 60 years. Oh, Lord have mercy. How many French fries at McDonald's or Burger King, whatever your spot is, have you ate in 60 years? All that grease, right? And this is why heart failure is the #1 cause for death in America. The whole country is dying because their arteries are clogged up. Because we are pouring that grease in the back of the pot by the stove, we pouring it down into our digestive system, and your digestive system feeds your circulatory system. So you're killing. Lord have mercy. I love this table right here. Y'all got all the hands. I'm just trying to get them the mic, y'all. This table right here, we are killing ourselves with our own spoon. And then when stuff stops working, when we get all clogged up, we come to the doctor, right? Oh, Lord, doctor, my back, my knees, my ankles, I need you to help me, please help me, right? And bless her heart, this one right here, she gonna actually look at you with some love and try to help you. But some of y'all have experienced them doctors that don't care, right? It's some of them doctors don't care. They don't even look in your eye when they talking to you. They don't prescribe the medication. They ain't even ask you about the symptoms yet. Am I telling the truth? So that's why I wanted to point her out and give her props where it's due, because all these doctors don't care like that. I could hear her care for you. And so therefore, we have become bottom feeders of a we have become bottom feeders for an industry that's making billions of dollars off of you because of your own bad habits. Did you know what I just said? Because you are not disciplined enough to cook your own food. You are making people billionaires. Did you hear what I said? We are so tired, exhausted, rents went up, prices of food went up, didn't nobody's salary go up, right? Fixed income, you know what I'm saying? And so we under so much stress that this bad habit is just killing us, and we don't even have the wherewithal to change our habits. And so when you hear of a sister like this, not just because it's her, but because of the accomplishment to change your habit in this environment under this stress, that ain't no weak, punctified thing to do. It takes strength to do that.
Exactly.
And so you got to clap for her so you can learn how to clap for yourself. You hear me? I'm saying we'll go to the coach game and we all up on the chair screaming for the coach. Go, baby, go! Right. But you won't cheer for yourself like that. We gotta fix that, man. Many of the sisters in here, you have given your last molecule of energy to everybody. You take on your husband, you make sure your boyfriend is good, you take on mama and auntie, Nene, Ray, right? The people at work, everybody's first. You at the bottom of your own priority list. In fact, some of you ain't even on your own priority list. So I have to teach people to put themselves at the top of their own priority list. Watch this. How many people in here got a cell phone? How many of y'all come out in the morning with your cell phone on 2%? Nobody? No. Oh, no, the accident or whatever. If you come out and you on 2%, you through for the whole day. You like, oh, that works. We're trying. You know what I'm saying? I need to somebody, huh? So you charge your cell phone consistently, but you won't charge you. You didn't hear me. So we haven't charged ourselves in so long, some of us don't even know how to charge ourselves. We've been on 3% for 10 years, struggling. Feet hurting, back broke down, you just scraping along, just trying to, you know what I'm saying? And the sad part is, you don't even know how to get better. That's true. So you just keep scraping along, and then you go to the doctor, right? And the doctor will bear you witness. Some of them doctors will be like this. Well, try that this week. Right? You go home, try, break out in the rash, right? Go back, doc, this ain't working, right? Try it this week. Am I telling the truth? Some of us are on 7, 8, 9, 10 medications and still hurting, still in pain, still don't feel good. And so now we're getting to a hopelessness to where, and I hate to say it, but I just got to talk to the room. Some of us are asking God to take us out of here. You hear me? I'm talking to everybody here that's suffering in silence. And you've been talking to people in your family so long, you don't even talk to them no more. You just suffer in silence. I'm telling you today, you ain't got to suffer no more.
How you doing today? Let them know who you are.
I'm doing well. I'm Zola Lucas.
Okay, and what do you do in life?
In life?
Yes.
Well, I'm retired. I'm 72 years young.
Okay.
I'm been retired 10 years.
Wow.
So what I normally do every day, I get up and go exercise.
Okay,
So
all right.
I do exercise classes in the morning. I do exercise classes in the evening. So really, that's the highlight of my life. I mean,
That's the life everybody want to be able to live.
Yes. I do things with my 12-year-old grandson, and I have a husband. I'm married, you know, so,
Yes.
So that's basically my life, you know.
So what's this event that you at today? What we got going on?
So I'm at the Bone and Joint Awareness event, and I think this has been my 3rd or 4th year coming, and I truly enjoy it. I always try to spread the word with my members from the YMCA, and I see a lot of them out today, you know, because it's something that we need to be aware of, especially as African Americans. You know, my husband, you know, he's having issues with knees, you know, but he says he's going to go out of here and never have a knee replacement, even though he may need it.
Wow.
But that's the type of person he is. I can't convince him. He should be here right now.
Yes, that was going to be my question.
I have that type of husband that doesn't matter.
Yes, strong.
Now, he's proud to say that he's going to go out of here and not have any surgery.
With all his natural parts.
But yet and still, you know, he's limping around, complaining about hurting every day. And that's what inspires me to get up and go exercise and try to take care of my body so I can be around here for him.
Yes,
you know,
yes.
to take care of him as we're aging together.
Yes, and thank God for that, for sure. Somebody got to stand up for the right to live life.
That's right.
Whoa,
That's
whoa.
right.
So you said this is your third one here?
I believe my third or
yes.
fourth, yes.
And so at all of them, what's one of the key points that you have taken from all of the gatherations that you done? I know it may be a gang up, but kind of narrow it down to something that first comes to your mind on what you received from these here gatherings.
Well, the main thing is you have to keep on moving.
Okay.
You know, that's the main thing that I always take. You have to keep moving. You know, you have to watch what you eat. You know, and keep moving and ask for help. Ask for help. That's a big one right there. Ask for help and trust. You know what the doctors are telling you.
Yeah, but the lady said that they follow,
we're
as the doctor said that they follow directions.
I know we're
Yes.
kind of non-trusting at times, but that's what the doctors are here for, you know. So if you want to be out of pain and you want to feel good, you want to have a decent quality of life, then you need to do what you're
supposed to be doing.
You know.
Yes.
So
hey, and thank you literally for this small gathering and this interview.
Thank you.
Blessings to you, sister.
Thank you.
Hope
Good
to see you at the
you.
next one. You already know. Let's go.
Peace.